Well, with Thanksgiving over now, people are rushing to get tested, and KPIX5's Kenny Choi shows us there are some new options in Alameda County. Kenny?
Ken, that's right. This is one of 27 free testing sites in Alameda County. At this site alone, this week, they actually more than doubled the number of daily tests to more than 330 starting on Monday. Health officials are expecting that surge in hospitalizations over the next coming weeks and new cases, and seeing a higher demand for tests.
Hi, do you have an appointment by any chance?
In Alameda, 2 additional testing events were added for this week. Some sites have doubled the number of target tests per day.
I did travel. I did go to holidays. I was in Arizona. I went on a family vacation.
Alameda County has the highest number of deaths in all Bay Area counties and the second highest number of cases behind Santa Clara County.
We saw a large surge right before the holidays, and we just wanted to make sure that there was great access to testing. 3 things are partly driving the higher demand for testing these days, according to Dr. Peter Chin Hong.
There are a lot of other infections as well. And these have very indistinguishable clinical features from COVID, so that will also bump up the testing demands.
Other reasons include the recent surge in the number of cases and holiday travel, as the Transportation Security Administration reported 1.2 million people passed through airport security checkpoints Sunday, the highest total since the beginning of the pandemic.
So the test, as soon as you get back, will pick up risks from more than 3 days ago. And then day 7 will be the best sort of like sweet spot.
Medical experts say it takes time for coronavirus to reproduce in the system before tests can detect it. The earliest is on day 3 or 4 after transmission, while most people will test positive by day 7. The idea to test this week after traveling is to shorten the length of the 2-week quarantine standard.
So that's really where people are moving towards, that idea of integrating testing and quarantine.
Alameda is seeing a 30% increase in new cases in its weekly average.
Yeah, I sort of get the, the game. You want to go somewhere, you get tested, and you think you have a clean slate. Unfortunately, medically, it doesn't work that way. But it's interesting. The question of when to get tested may depend on age, huh?
It does, Ken. Top health officials say that if you're 65 or older, you should get tested immediately, especially if you're seeing those symptoms. And if you've traveled, that's to assess the risk sooner for higher risk groups. But for those who are younger, health officials are recommending to get tested 5 to 10 days after travel. So that would be this week. And you just heard Dr. Peter Chin Hong saying that 7 days would be ideal for those in the younger demographic. Ken?